In case you fall into the category of persons that prefer to take their medicines the way they want to, or you've been asked to take a tablet a day and you think that taking two is going to make you better, or you just feel like maybe these people don't even know what they are doing. If I take much more than I've been asked to take, I'll feel better. This video is for you. In today's video, we're going to be talking about tablets and the different forms, how they are designed and how they are meant to work. I believe this is the reason for so many medication errors that leads to a lot of side effects and makes our medicines not to work. So this video is to educate you that not all tablets work the same way. Not all tablets are designed the same way, and they are designed in various ways to serve you and to help you get better. So in today's video, I'm going to be talking about slow release tablets. Slow release tablets. So what are slow release tablets? Slow release tablets are tablets that have been designed, to release the active ingredient, that is the major ingredient in the medicine, gradually over time, such that it reduces side effects and it is convenient for you to take. This means that for tablets that are not slow release, right, you will be required to take many times a day, say 3 times or 4 times in a day. But for slow release tablets, you can be required to take just once in a day or twice in a day, because the medicine keeps releasing into the body over a long period of time. So why are these medicines prescribed? Number one is to improve patients' convenience, meaning that instead of taking for 4 times a day and trying to follow up with 6 hourly, or maybe taking your medicines 4 times a day, if you're taking a slow release tablet, you only be required to take it once or twice a day. This would actually improve your convenience. Secondly, it would also reduce dosing time. What that means is that you don't have to take plenty of times. Thirdly, it will reduce side effects, because instead of having to take these medicines for a long period of time, causing stomach irritation and all, you just take like once or twice and then the side effects are actually reduced. Lastly, it maintains a consistent level of the medicine in your bloodstream for a longer period of time. So how do you identify slow release tablets? Some of them will have something like SR written on it. I know a lot of us take Diclofenac. For those that have not seen it before, there are some of them that come as Diclofenac SR. The SR in front of it actually stands for slow release. There is Metformin, which is used in diabetic management. Metformin would have something like XR, which stands for extended release. You see something on it, the name of the medicine, and then you see LA. LA means long acting. You see something like MR, that will signify modified release. All of these are all different types and forms of slow release. So if you see something like that on your medicine, it actually means that they are slow release medicines. So in case you do not know any of these abbreviations, whenever you get your medicines from your pharmacist, ensure that you ask questions. Are there rules I'm supposed to adhere to concerning these medicines, so that your medicines will work well for you? Don't just decide on your own, because if you're told these things, right, if you're being educated on these things, it would actually help you to take your medicines better. All right, so now that we've talked about the different forms of the slow release, what are the don'ts, as in the safety measures that you're supposed to observe when you're taking slow release medications? Number one, do not crush, do not chew. This one is for persons that have decided that they must always crush or chew and that they cannot swallow medicines. If you cannot swallow, please ask for a liquid form or an alternative form that would serve you. But so long as they are slow release tablets, it is not allowed for you to chew or to crush. This is because if you chew or you crush this tablet, it's going to release the active ingredient all at once, but they've been designed to release over a period of time. So if you release them all at once, it can cause serious side effects for you, because those medicines were not designed to, release all at once. They were designed to release, gradually, just a little bit at a time, a little bit at a time. But instead of releasing that way, because you have chewed, because you have crushed, it will now be released all at once, and would not work for you as it should. Secondly, ensure that you swallow it whole with water. Make sure that you use water to swallow so it can go down smoothly. Like I said earlier, if you have issues with swallowing, ask for a liquid version or another dosage form. It doesn't have to be tablet. There are some other medicines that can come as liquid, they can come as suppositories, and all of that. If you know you have a problem with swallowing, don't just collect your medicines and go away like that. Ask for an alternative and you'll be attended to. The third one is make sure that you stick to timing. Stick to the timing of the medicine. If you've been asked to take once, you take once. If you've been asked to take twice, you take twice. For those ones you've been asked to take once, don't take twice because you do not feel better. The medicine is working gradually. So just, be patient and stick to the timing so it can work well for you and reduce side effects. There are some specific instructions that come with different medicines. Some you can take with food, some you should take on empty stomach. Ensure that you ask questions concerning your tablet so that you know if you're supposed to take it with food or if you're supposed to take it on an empty stomach, so that as it has been designed to work either with food or on an empty stomach, it would work well for you. Because if a medicine has actually been designed to work on an empty stomach and you take food with it, you would not get the effect. Like, the medicine is not going to work as it should. And if that medicine has been designed to work with food and you take on an empty stomach, you would also be exposing your stomach to either irritation or other side effects. Lastly, ensure that you do not switch brands without advice. I talked about brands and generics. The video is here on my YouTube channel. Just look for it and watch it. I'll put the link somewhere. Do not switch between brands without advice. This is because different companies have their way of producing their own medication. Different brands have different release mechanisms, so you would not want to switch brands without advice, because you may be taking it the wrong way. Their release mechanism may be different, or the new medicine release mechanism may be different from the old one, and so if you are taking the same way you were taking the old one, you'll be making a mistake and putting yourself in harm's way. Always remember that because all the tablets look the same does not mean that they work the same way. They do not work the same way. They've been designed to work a certain way, and there's the right way to actually take your medicines so they can work for you. If you found this video helpful, kindly like, share, and comment. Don't forget to subscribe for more medication safety tips. See you in my next video. My name is Matilda Inibe. Bye.